Good morning, everyone. My name is Moshe Schuper, partner at Roth&Co. Roth&Co was founded in 1978 by Abraham Roth and has evolved into a leading accounting and financial services firm with over 170 people and locations in New York, New Jersey, Illinois, and Israel. We have a large healthcare client community, and I am one of the partners that maintains a strong focus on skilled nursing, assisted living, drug treatment centers, and home health industries. As part of our mission to be a valuable resource to our clients and the community, we have hosted a variety of webinars on topics that are critical to today's environment. This is a continuation of that, with the focus today being the nursing home industry. I'm proud to be hosting this conversation with two outstanding individuals in the industry, Mark Parkinson and Steve Zicherman. Mark is the president and CEO of the American Healthcare Association, which is now the largest association in long-term care and represents over 14,000 skilled nursing and assisted living facilities. Mark served as the 45th governor of the state of Kansas, and prior to that was the owner and operator of facilities in Kansas and Missouri. Mark is widely recognized as one of the top lobbyists in the country. Steve is a managing partner at LTC Finance and Advisory Services. LTC is a premier healthcare firm that has close to 1,000 employees and revolutionized the industry by providing a full centralized back office for operators. LTC also provides a full suite of financial services, including financial cycle management and reporting, due diligence, and underwriting advisory services. Steve has earned a reputation as being one of the most trusted advisors in the industry. Welcome, and thank you both for joining us.
Mark, if we could start the conversation with you.
Sure.
Obviously, the country has gone through a crazy time last few months, and the nursing home industry has been hit really, really hard. From your perspective, how do you think we're doing today compared to 3 months ago or even a month ago?
Well, Moshe, it's great to be with you today, and appreciate the opportunity to talk with all the folks that have signed up for this and get the word out on kind of where things are at and how things are going and where we think they're headed from here. You're right, no doubt. This has been the toughest year in the history of long-term care, and I doubt we'll ever have a year that's this bad. We'll go through recessions and depressions as a country in the future, but nothing that just so dramatically impacts what we do, because we're the center of this. And so it's been horrible on the clinical side. 40 or 50,000 plus deaths in long-term care. The emotional toll that's played on our workers and our frontline heroes has been incredible and challenging and difficult, and it's going to take a long time to recover from that. On the business side, it's also been really, really tough. Nationwide, we've seen a drop in occupancy that's differed by provider type, but has been significant for all. I think nationwide, we're looking at about a 10% drop in occupancy on the SNF side, maybe 5% on the assisted living side, a little less than that in senior living. And then in those parts of the country that have gotten hit hard by COVID, particularly the Northeast, the census drops are much more dramatic than that, an average of 20 or 25%. So, we have a double whammy of incredible clinical challenges and incredible business challenges. I think the good news is we're doing better on both fronts than we were 3, 4, 5 months ago. On the clinical side, the number of new cases in nursing homes has dropped dramatically. The number of deaths has dropped dramatically. We've been much more able to contain it. On the business side, a combination of really enormous resources from the federal government and some from some of the states, I think has put most providers in a position where they can start to see some light at the end of the tunnel. We came into this with certain objectives in DC. We've been able to exceed all of them. And so I think, roughly the total amount of reimbursement from DC from the CARES Act is now up to $12.4 billion. By the time that this last $500 billion gets paid out, which is going to take about 4 months, the average provider will have received over $800,000. On top of that, there's been a lot of other things that have happened that have been helpful. So all in all, we think we've been able to achieve maybe about $20 billion of recovery. I think that what that has done for about 80% of the sector is it's allowed them to keep their head above water and hopefully make it through to the end of the year when we can get a vaccine. I still think there's about 20% of the sector that got hit really hard by COVID. These are buildings that are principally in New York, New Jersey, Connecticut, Massachusetts. They got hit really hard early on that need a lot more help than what we've been able to get so far. But I'm optimistic that with our lobbying efforts in DC, we're going to be able to get those buildings help. If the pandemic is over at the end of the year and we really do have a vaccine in January, February, I think we can get through this. I'm not sure I would have been that confident 4 or 5 months ago in saying that.
On that note, how long do you think the occupancy will go back to pre-COVID levels? Any idea of what you think that's going to take?
That's really the most important question on the business side. How long will it take us to get occupancy back? We follow occupancy very closely, and there was about a 1% decline in occupancy every week from roughly mid-March until the 1st of June. Occupancy seemed to flatten at that point. It seemed to have bottomed out. And we thought, this is great. We bottomed out. We can start rebuilding. Unfortunately, the numbers indicate that we're not rebuilding. It has not gone up materially since it bottomed out on June 1. In order to have a true recovery, occupancy has to start improving. And that's a combination of several things. First, the hospitals have to get fully engaged in accepting patients, doing elective surgeries, creating the discharges that create our post-acute business. And secondly, the public is going to have to get confident in being able to send their parents and grandparents to live in our buildings. Unfortunately, I think both of those things are going to take longer than I would have thought. So I wouldn't be surprised if occupancy is relatively flat for the rest of 2020, but that we then start gradually rebuilding in 2021, particularly when there's a vaccine and we can get the public confidence back.
Steve, on your front, what have you been seeing with your clients, your financials? How's it going now compared to 3 months ago?
So first of all, Moshe, I want to start with a huge shout out to both you and Mark and the organizations that you represent. Firstly, with the host, Roth&Co, I have to say that you besides for being a great accounting firm, once COVID hit, you guys took an extremely aggressive, proactive approach. You set up a designated advisory team and a series of webinars that really helped the masses, thousands of people through PPP and the CARES Act and the unemployment, family leave, sick leave, HHS funds, all the confusion that came along with that. So you guys did a really unbelievable job helping individual clients as well. Really, really unbelievable. Also want to give a shout out to Mr. Parkinson. Governor, you and your, I remember conversations prior to COVID and talking about the importance of, getting in front of elected officials and the importance of the advocacy that you do. And I think we've all learned that, lived that lesson over the last few months. Really your organization bringing our needs and our challenges in front of the elected officials, making sure that the skilled nursing industry does not get forgotten, and really saving us from the brink of disaster. So, a huge thank you from us and our clients for everything that you do. Regarding the financials, I'm really, seeing on the ground, we're seeing the same thing that Mr. Parkinson just spoke about, which was that yes, our clients in the Northeast, New York, New Jersey, Pennsylvania, Massachusetts, Connecticut, many of those places have seen occupancies going down from approximately 85% to close to 60% on average. We've seen a tremendous impact, a lot of loss of life, and a lot of big dramatic issues. A lot of the Midwest, as you go towards Middle America, they've gotten hit a little bit later, and maybe not to as large of an extent. They're seeing occupancy drops of 5 to 10%. Clearly the electives are hurting us. The media perception of us is not helping at all either, and the fear that people have of putting their loved ones into skilled nursing facilities is not helping us. The positive, obviously, is the fact that as we move through April and May, the government, the federal government, certainly stood behind us, and a lot of the state governments stood behind us. So really just echoing a lot of that. I think that we were all hoping for a V-shaped recovery, and we all thought that, okay, come the other side, we're going to come right back up. And obviously that's not playing out. But the widespread distress that we were panicked about in April and May has not played out either at this time.
What do you think are some of the long-lasting effects of this whole thing? Going forward a year from now, what do you see as some of the effects that won't change and things that potentially will be the same because of the whole pandemic?
I think certainly the way we assess risk in this industry has changed completely. You know, we used to talk about the fact that it's a high risk industry, but there was always the risk of pen stroke, that the government maybe can really hurt us with the stroke of a pen, and by changing some reimbursement and making it more difficult for us. We also, the risks we had, we were having tremendous staffing issues prior to COVID. I think that a lot of that, the risks have changed, not necessarily gotten better or worse, but the lay of the land has changed, where we see that our industry has turned upside down, our world has turned upside down, and we've seen that pen stroke risk actually work the other way, where the federal government came in and helped us stabilize our industries and our businesses and our facilities. We've also seen that the staffing, at least in the short term, we've seen ironically, we've seen a dedication from our staff. We've seen that the staff that are there because they want to be there, because they want to service the sick and the elderly. And we've also seen a little bit less, at least in the short term, we've seen less competition from other industries in terms of hiring, being able to get our staff on board.
Mark, I'd like to ask you the same question. Where do you see us a year from now?
You know, on the business side of it, I think a year from now we'll be past this. I've been honored to be asked by Secretary Azar to serve on a national vaccine panel, and we get briefings every couple of weeks on where we're at with the vaccine, what the plans are, and we try to give good input. And I'm really optimistic about the vaccine development, and also the development of some therapeutics to reduce the overall deaths rate. So I think we're going to have huge progress in the fall, and I think we're going to have a vaccine by January. I think it's going to take longer to get it out to people than folks realize. It's a logistic challenge. But I think that I think it's going to be a one-year phenomenon. The country basically shut down in March of 2020. I think by March of 2021, this is hopefully behind us. That's what I think. And I think that once that occurs, we will slowly grow our occupancy back, and we'll slowly grow the confidence level back with the public. And so on the business side, I think we'll be in much better position than we are right now. On the government side, we're going to have a massive amount of oversight, regardless of who wins the election in November. There'll be hearing after hearing in DC and probably in the state capitals on what went wrong and what needs to be done to fix nursing homes. And there'll be a lot of ideas, and some of them will be helpful and some of them will be terrible. And it'll be our job to make sure that the ones that make sense get adopted and the ones that are terrible don't. But a lot of the wish list things of our critics will be on the table under consideration. There'll be minimum staffing requirements that are pretty dramatic and not paid for that will be under consideration. There'll be folks that think that we need to have even more surveys and more deficiencies, and those things will be on the table. But hopefully there'll be some thoughtful things as well. And one of the things that we've learned from this is that having private rooms has really been helpful in keeping the pandemic from spreading, the virus from spreading. If we could get some government assistance to recapitalize our infrastructure and convert or build new buildings that have more private rooms, that could be a really positive development. there'll be a greater emphasis on infection control. You know, we've had a big emphasis in the past. That's going to be multiplied. And if we can get the government to get off of our backs on the stuff that doesn't matter very much, so that we can spend our resources and our time on infection control, we can reduce deaths, not just from COVID, but from a lot of other viruses that we face throughout time. We also hope that we can use this as an opportunity to develop a more collaborative survey system. The survey system is horrible, it doesn't work, it creates bad outcomes. And part of our job at AHCA will be to hopefully create a new survey system that will be more collaborative. So what I'm hoping for the future is a more collaborative approach with the survey teams, a real dedication to working on outcomes for residents, and just some changes that I think can really create those things. But what we'll be fighting off will be irrational oversight that just attempts to blame us because what has occurred over the last 5 months.
I think you definitely see that in the New York politics, that's for sure. Going into the government side of things, obviously PPP and the CARES provider relief had a huge impact. It really provided, I think, a lifeline to many homes and many providers. Talking about that, HHS recently released a $5 billion or news about an additional $5 billion that's coming out. The initial reports were that it was related to high COVID homes or people struggling or providers that are struggling. Now it seems like it's more related to performance measures. Could you give us a little insight about what's going on the Hill in terms of what type of performance measures, what changed?
Sure. Well, we were very pleased that we were able to get another $5 billion out of the CARES Act. We had previously received $7.4 billion, which frankly, on a proportional basis, is more than any other provider group. So when we got the additional $5, we were quite happy with it. We had specific suggestions to HHS on how to allocate the $5 billion, and some of them they adopted and some of them they didn't. It's really not an issue for the Hill. It's just totally within the decision of Secretary Azar on how to spend this $5 billion. And so the release that they issued on Friday did not give much information. But prior to the issuance of the release, I was able to talk with Secretary Azar's top people on this program for about a half an hour, and they explained to me exactly how this all works. I'm here in Bethesda right now, Moshe, and we're by the National Institute of Health, which is where we live, and there are all these helicopters that come in and out all the time, so I apologize for that background noise. I think they're now past us. So let me give the folks on the call some really fresh information about this $5 billion. You have to think about it as 4 different programs. The first $2.5 billion will be sent out to every single building in the country. It is not an application process. It's just like the first 3 payments. You're going to show up one morning and you're going to see some funds that hit your account. The money is for PPE, testing, and staffing. You get to decide what you want to spend the money on. It's your decision. How much you get depends upon 2 things. It depends upon whether or not you have already received one of the point-of-site antigen machines that they have agreed to send out to everybody. About 1,600 buildings have already received those machines. And it also depends upon the number of beds that you have. For an average size facility, which they define as 104 beds, I know I'm getting very specific here, but for an average size facility, if you have the antigen machine, you will get a check for $90,000 for your building. If you don't have the antigen machine, you'll get a check for $170,000 a building. It will show up sometime 10 to 14 days from now. That's the time point that they're trying to get it. The reason that folks with antigen machines will receive less is because they believe that the cost of testing will be much lower for them, and it is. You know, the cost of those tests is somewhere between 20 and 40 bucks. The cost of the PCRs is somewhere around 100 bucks. There's no free lunch, so coincident with when this money goes out, CMS is very likely to issue a rule that says that if you're in a state that has a positivity rating of above 5%, you need to test staff once a week. Now, ironically, those are not the states that are in the Northeast. So your buildings in New York, New Jersey, Connecticut, Massachusetts, Pennsylvania, all those buildings, states that got hit hard early on, their positivity rate is less than 5%. You won't have the weekly testing requirement, so you can spend the money on staffing or PPE. So you're either going to get an average of 90,000 or 170,000 a building. So that's $2.5 billion of it. $2 billion of the $5 billion will be spent on a value-based purchasing program. They're trying to incentivize us to do everything that we can to keep COVID out of the buildings. I mean, I know we already are, but they believe that this program will further amp up our efforts. And so, you know, they listened to and adopted almost all the suggestions that we had on the program. It is prospective, so what's happened in the past doesn't matter. There are 4 separate programs, one for September, one for October, one for November, and one for December. Each of them has $500 million that's available. They will exclusively use the NHSN data. You don't have to submit anything. They'll just look at your NHSN application. And for buildings that have an average or better than average COVID case count of new cases, average or better than average of your community, the community that your buildings are in, you will receive a payment. The amount of payment, we don't know yet. It's a complicated formula. They haven't, I'm not sure they've actually come up with it yet, but they're going to brief me on it in a few days. They don't have it yet. We think that the average building that qualifies for a payment will get about $70,000 a month. But it could be lesser, it could be more, but net, it's going to be around $70,000 a building. So there's a tremendous opportunity for you to work with the folks in your buildings, incentivize the people in your buildings to really keep those numbers low. Not just obviously the right thing to do clinically, there is money available there. Each month is a separate month. So if you don't get it in September, you can get it in October and vice versa. If you did get it, that doesn't necessarily mean in one month that you'll get it in the next month. It is completely prospective. Past cases don't matter. Cases that you admit that have COVID, so if you've set up a COVID-only wing and you're taking people from hospitals or other buildings as a service, that doesn't count against you either. It's new cases of COVID that develop within your building. And then there are 2 other amounts with the $5 billion. There's a $250 million fund to reimburse people who set up COVID wings or COVID-only buildings. As they originally had it written, it was just for future expense. We're encouraging them to include past expense because I've explained to them that I think, you know, all the COVID-only buildings that have been set up are probably all of it is going to be set up. So they need to reimburse people for the past. We'll see when the final rules come out if they do that. And then they've also set aside $250 million for providers who want to collaborate with outside groups on plans to reduce COVID in their buildings. That's very undefined and we don't know very much about it, so we'll have to see the details. And so, you know, the first $2.5 billion is simple, just a check will show up. The other $2.5 billion is money that's available to you if you do the right things and go after it. And, you know, part of what we'll do at AHCA is we'll make sure our members know exactly how to get that done, and we'll work with you every step of the way to hopefully get as many of you possible some of those additional funds.
Mark, can I jump in with a question?
I know that you've been,
Sure.
Can I jump in with a question over here? I'm wondering if, you know, part of what we were hoping, at least for our New York, New Jersey clients, was that they'd be getting some targeted funds because they were hit so hard with COVID. These, you know, a lot of people in these states did not get state assistance, and now apparently they're not getting, you know, at least special treatment in this targeted distribution. Is that completely off the table, or is that something that people are looking for?
Yeah, I mean, we've been advocating for that, Steve, and we haven't succeeded in it yet, but we haven't given up on it. We still have a shot at it. I mean, I don't know if you saw the president's comments Friday evening at his New Jersey news conference, but those comments that were very supportive of the sector and very supportive of folks that have gotten hit hard early on came just 2 days after we had an opportunity to make our case to him. And so we're lobbying, you know, obviously at the highest possible levels. And so we don't think that this allocation means that payment, which we call the COVID hotspot payment, is done. We still think that we're in play on that, and we're actively advocating for it. I have a hard time handicapping the probability of it. I wouldn't say that it's likely, but I also wouldn't say that it's a Hail Mary. It's somewhere in between. And it is our major focus at this point. Now that we have this distribution of $5 billion figured out, our 100% lobbying effort on the HHS fund is exactly what you're saying, which is a COVID hotspot payment. And another issue will be whether there's any money added to that fund or not. It's down to $50 billion right now. If a stimulus bill passes, they'll probably put more money in it, which will make it easier for us. But, you know, a lot of people are starting to point the finger at us and say, hey, the SNFs have gotten quite a bit. You know, we need to get some more help. So, you know, there's challenges, but I think that we're in the running to get that payment. We still have a real shot at it.
Is there a reason that certain states have not come forward? Is there a reason that certain states have come forward with their own, you know, stimulus, and let's say the New York, New Jersey have not?
Well, it comes back to the conversations that you and I had before the pandemic. If you are active politically, if you've worked your tail off for the last 10 or 15 years, like we have at AHCA, to develop the political relationships that you need, you can get stuff done in DC. And the same is true with the states. So in some states, our ability to influence the governors and the legislatures is greater than it is in other states. And I mean, I think it's horrendous. That's what's happened in New York to the providers in New York. And they've received absolutely no support from the state. In fact, I think there's been a 1% Medicaid cut, if I'm not mistaken. So we need to do better politically in New York. And the members and the operators have just got to, you know, and one of the problems with New York is the members are not united. There's multiple associations, and there's not a single voice, et cetera. We need to do better. We have a really good affiliate in New York, but they can't do it on their own. We need folks to join up with them and help us fight the effort in New York.
How does an operator join the government and plead their case? You have any recommendations? Obviously, joining the association is important. You have any other recommendations, things that they can do to have their voices heard?
Well, I mean, I hate to, I didn't mean to come on and do this as an advertisement. So, but I'm going to do this anyway. You know, people can look at my face and they can see I'm almost done with this career. So this is not for me. This is for the future of the sector. The only way that we can win is everybody has to join their association. That's the number one step. And we told people that before the pandemic, and I really appreciate Steve's comments. Once the pandemic occurred, people realized and understood what we were talking about. If we didn't have the ability to go in and talk to the leadership, to go in and talk to the president, when it's really important and we need to do it, we would not have gotten these funds. These funds did not come because they thought, oh man, we really need to do everything we can to help the skilled nursing. These funds occurred because people have worked their tails off for 10 or 15 years to create these relationships. It is very frustrating to me when I talk to people and they say, I don't see the value of joining my association. What's the value? And the value is that when you are about to go extinct, which is what's happened here, there's somebody there to rescue you. So the number one thing for people to do, if you're not a member of your association, even if you think the association's incompetent, join it, become a part of it, and fix it. That's the number one thing. The number two thing then is any additional political activity that you're willing to do. And thank goodness we have people across the country that are willing to write very big checks that really improves our level of access around the country. So it's a combination of getting involved with your association and getting involved politically.
Switching gears a little bit, I know that you're still advocating for additional funds. I know you've been quoted as trying to get an additional $100 billion. With the election coming up, how does that play out? And obviously, I think it's needed, and the question is, how likely would it be?
Well, I'm sure everybody on the call knows that they're trying to pass what we're calling the fourth stimulus bill. Stimulus 4.0 is what it's being called in DC. They're flopping around right now. They're not negotiating. The consensus in town is that they'll get their act together here, maybe not in August, but possibly even as late as the end of September, and that they will pass another stimulus bill. The Democratic version calls for $100 billion to be added to the CARES Act fund. The Republican version calls for 25. I think most people think they'll end up maybe adding another 50 billion to it. So if they add that and we end up with $100 billion in the fund, that really increases our chance of getting that COVID hotspot payment that Steve and I were just talking about. The election has a gazillion ramifications on us. And, you know, if a scenario right now is that Democrats end up controlling everything. If you look at the polling today, you know, Biden would win, Democrats would take the Senate, and they would take the House. On funding issues, that's probably good for us. They tend to be more supportive of Medicaid than Republicans. But there's a counterpoint too, which is that on regulatory issues, it's going to be really, really hard if D's take everything. These topics that I discussed, like minimum staffing requirements, banning arbitration, more regulations, more oversight, more hearings, we'll be facing those on a weekly basis. I've said before that I think what works best for the sector is when we have divided government and one party doesn't control everything. That's what we usually have, but every once in a while we'll have a 2-year period of time where one party controls everything and things get really hard. The 2-year period of time when Republicans had everything in 2017 and 2016, after the 2016 election, we almost got Medicaid taken away in a significant way. I think if Democrats control everything, which is the way it looks to me right now, it's going to end up, we're going to have a really challenging 2-year period of time on the regulatory and oversight side.
I know we've been talking a lot about SNFs. Anything on the assisted living side of things?
I'm happy to jump in again, Steve. I don't want to dominate the conversation. I think the assisted living side has fared better than the SNF side. Okay. If you look at the occupancy numbers, the numbers have been about half the decline, and there's a lot of reasons for that. But I think that because it's fared better during the pandemic, it'll probably come out a little better after the pandemic. But Steve, let me turn it over to you for your thoughts.
Yeah, I know I did hear a concern from a lot of our assisted living clients where they're saying that the return to normal in an assisted living or an independent living may be more difficult because a lot of that care is more voluntary, meaning they're able to technically be at home, whereas in a SNF, the acute residents are not able to. So, you know, I guess there's two sides of that. So their decline has not been as strong, but there is concern. I am hearing concern about the time it's going to take to get back to normalcy.
What about one of the questions that came up is liability protection. Has there been any talks, Mark, you can answer, Steve, if you know anything about it. Has there been any talks about liability protection for the nursing home operators?
Yeah, our top issue in the stimulus bill. So, you know, where we're at right now is that in DC, most people think they'll pass one more stimulus bill and that's it. And a while back, people thought that would happen last Friday and it all got broken down. And so we'll see. Probably not this week, but our lobbyists still believe that sometime in August or September, they will pass a stimulus bill. In the stimulus bill, Leader McConnell, the Republican leader of the Senate from Kentucky, has put in his version of the bill some really, really helpful language. It covers assisted living, it covers skilled nursing, and it basically excuses us from any conduct unless it is intentional or gross neglect. It also limits the amount of recovery so that punitive damages can't be more than actual damages, and it removes all the cases to federal court, which is really helpful because the runaway verdicts have occurred in state courts. Normally, we would have no chance of getting a liability protection like this because it's a very partisan issue with Republicans typically supporting this, but Democrats not. And both sides feel very, very strongly about it. But we have a chance this time. And the reason we have a chance is that Leader McConnell has said that this is his #1 issue, and he will not let a bill pass the Senate that doesn't include this language. If he sticks with us on that, we've got a real chance. Now, again, it requires a stimulus bill to pass, which right now looks a little bit iffy, but hopefully a stimulus bill will pass, and we've got a fighting chance for this language to be in the bill. If it's not, you know, we've got a real problem. The plaintiffs' lawyers are gearing up. The statistics for us are bad. It'll be hard for the plaintiff's lawyers to win these cases in front of a jury because there's a lot of good facts for us. You know, we're doing everything we could. We just didn't have equipment. We didn't have testing. This virus was spreading by folks who had no symptoms. All of those are facts that will help when we get to a jury, but it costs a lot of money in defense to get to a jury. So we really need this liability.
Switching a little bit, I know that there's been, Steve, there's been some issues related to change of ownership and how to apply and related to the funds from the stimulus package. I know I've definitely fielded a bunch of calls related to it. What's your experience related to that?
So I will say, as a lot of our client base are active buyers, so we do have a number of clients that changed ownership in 2020. So the way this played out was that when the CARES Act and the Provider Relief Fund was set up, HHS was tasked with getting out a lot of money in a very short amount of time, and they did actually a great job getting out that money to the masses, to the facilities. They did not, there's a lot of the details were left to be taken care of later. So those buyers or those sellers that sold their facilities in 2020 were instructed to return the HHS stimulus funds, and that the buyers may have an opportunity to get additional funds at some later date. Wasn't a lot of information that came out over the last couple of months between May, June, July, until the end of July, when they did come out with a new portal indicating that those owners that purchased facilities or had a change of ownership in 2020 would be able to report their revenue and sign up and be able to be eligible for targeted funds at this point. I don't know if Mark, I don't know if they've finalized what exactly those funds would be. Would it be exactly like the other facilities or something different?
Yeah, we're in the same position that the two of you are. We've taken a lot of questions from members on the CHOW issues, and I think the news on that is pretty good now. I think you're exactly right, Steve. They did a really good job at getting a ton of money out to people that were kind of in a normal situation. But if you'd had a change of ownership, your payments probably went to the prior owner, and the prior owner probably ended up sending them back to HHS, and that's extremely frustrating. We've been talking with HHS about this for the last 4 months, and they've been saying the right things to us, but they weren't really doing anything about it. And I'm not really being critical of them. It's because they were doing so many other things that they viewed as higher priority and just getting more monies out there to various providers. We decided that 2 weeks ago we were going to take this into our own hands, and we were going to create our own solution to this. I talked with the folks at HHS. They said they would appreciate that. So if you're a member, we've created a dedicated solution at AHCA. You access it by sending an email to CHOW, C-H-O-W, at AHCA.org, CHOW at AHCA.org. Let us know your situation, the name of your buildings, what funds you have and have not received, when your transfer occurred, et cetera. We're putting those together in a really user-friendly form for HHS, and we're going to take them over to HHS, and they say that they'll help us get them paid. In addition to that, HHS has agreed that they will set up their own portal. They announced that it would be set up the week of August 10th, which is this week. And so the way the government works, we're assuming it'll get set up on Friday. And at that point, they'll have their own portal where you can submit your own information to them. But here's the deal. There's a lot of other provider groups that have these same issues. Every other provider group, home health, hospice, you name it. So when they open up that portal, they're going to get thousands of pieces of information, many of which are complicated. So what we're doing is that when you send us your information at CHOW at AHCA.org, we're going to help you file with them on their portal, but then separately, we're going to take our stuff over to them, and we're going to have a separate meeting with them, and we're going to get these SNF things paid. So look for their portal, but also contact us. I think if you do both, you're going to improve your chances of getting paid.
Thank you. Good information. I'd like to switch to another topic, public confidence. Obviously, news stories are out there. It's constantly out there whenever you open up Fox News or any other news outlet. It's a question of, our people feel safe within the communities. How do we restore that public confidence? How do we bring it back to the point of pre-COVID?
Well, I'll jump in, Steve, and I'll take this one first. The view from the public is understandable. I mean, you just have to ask yourself, how comfortable would you feel right now about putting a parent or a grandparent in a nursing home? And I think the answer is it depends a lot. It depends on the nursing home. It depends upon what's going on in the community, et cetera. And we know about the sector. You can just imagine how people that don't understand our sector feel about it. We do a lot of polling. My background in politics has taught me the importance of really understanding where the public is coming from, so you're not guessing and you're not making decisions based on anecdotes. So we've been polling what the public feels about nursing homes and about assisted living buildings each year for the 10 years that I've been at the American Healthcare Association. So we have a really good database and understanding of what the public thinks of us. Coincidentally, we had polled the public, and this is a scientific, we spend $35,000, we do the real polling firms that you've heard of, and they do, nationwide polling. And coincidentally, we polled in November before the pandemic. So we knew exactly what the public thought of us, pretty fresh with the pandemic. So then we polled again and basically what the public thinks of us hasn't changed. So if you ask them favorable, unfavorable on nursing homes, it's about 50-50. If you ask them favorable, unfavorable on assisted living, it's about 70-30 favorable. Interestingly enough, if you ask them favorable, unfavorable on skilled nursing centers, it's like 75-25 favorable or unfavorable. But you don't want to use the term nursing home in your building. You definitely want to call yourself a skilled nursing and rehab center. That gets you an approval rating above even above assisted living. So then we polled again in May, and we thought, oh my God, surely our numbers will be devastated from what's happened. Believe it or not, the numbers went up. And the reason the numbers went up is that for all of healthcare, hospitals, home health, hospice, the numbers went up. People had an appreciation for what was going on in care. We then polled again in July, and you might say, why the heck would you poll again in July? We polled again in July because our members agreed to a special $10 a bed assessment, and some of our vendor partners stepped up. And so we have allocated $25 million to a nationwide media campaign to try to improve our reputation. And so we were polling in July to see what kind of messages would move the public and kind of where we were at again. And that July polling indicated that we had fallen back to the pre-pandemic numbers, about 50-50. The public, by and large, believes that this was not our fault, when you do the polling and ask them. And that doesn't mean that they're comfortable in sending their parents into our buildings, but they don't blame us. They blame the pandemic and some of the bad policies that occurred. So we are starting a nationwide campaign, not network, we can't afford network, but nationwide cable campaign that's targeted at women age 40 to 60, because that's the age group that typically makes the decisions for their parents, that will start at the end of August, and it is designed to tell our story, to tell the story of the heroes in the front lines who worked double shifts to save folks, and when they had the resources were able to do it. So I just think it's a matter of that, it's a matter of time, it's a matter of the pandemic going away, and eventually we'll get back to where we were, but it's going to take some time.
I would just add on to that, that I think it's unfortunate that the hospitals were the heroes and the SNFs were the skilled nursing facilities were the bad ones. I know any operator that I know has probably not slept in 4 months since the beginning of this pandemic. The heroes, they are the frontline heroes. So, I think that it is unfortunate what the media has portrayed over here. And I would say that a number of operators have made the case, now that people see how difficult it is in many instances to take care of their elderly parents at home, and they see the need for skilled nursing facilities. They're making the case that, in fact, at this point, the infection control measures are better at a skilled nursing facility than they are at home, where you have your children and grandchildren going to school and coming back and not implementing those same measures at home. So I think there's an argument to be made, and I do think, we do think that with time, we're going to get back to where we need to.
On the heroes front, obviously, there's a factor here that we should be discussing is employee morale. How do you keep that morale up? How do you create a facility, create a system where the employees feel good about their job and feel safe?
I'll just go ahead.
No, Steve, you go ahead.
Yeah, no, I'll just say that some of what, I'm not on the lines with the staff, but I will say that our operators have done a tremendous job in, whether it's a social media or just that campaign indicating that, hey, we recognize that you, our frontline staff members, are heroes. And I think they've gotten out that message to their staff. I don't have more to say on that.
Yeah, I have a very specific philosophy about running organizations, and my philosophy is that successful organizations are mission driven, and they're also driven by metrics. You've got to be driven by mission, and you've got to be driven by metrics. And my view is that the most important metric in any organization is employee satisfaction and engagement. Employees that are satisfied and engaged allow you to achieve your other goals. But if they're not satisfied and engaged, it's really, really hard to hit your other goals. So what I would ask providers to consider doing is really doubling and tripling down on your employee engagement and satisfaction work, measuring it, figuring out where you're not doing well, and then working hard to get better at it. I hope that all of you saw the earnings from Ensign last Wednesday night. And if you don't know what I'm talking about, pull up Ensign. They're a publicly traded company. The ticker symbol's ENSG. And Ensign announced a 90% increase in earnings in the second quarter of this year. Think about that. The second quarter of this year, not including any revenue that they received from the federal government. In fact, they sent back the $110 million that they'd received from the federal government. I know the folks at Ensign really well, and at Ensign, they will tell you that their number one metric is employee satisfaction and engagement. They'll even openly say that our customers come second, our employees come first. And so if you're not measuring employee engagement and satisfaction, if you don't have an active program, you are missing out on an incredible opportunity. And I think that, when you think about this value-based purchasing funds, these 4 sort of contests in September, October, November, and December, where if you succeed, your building might get an average of around $70,000. That's a perfect way to align your employees' interest with yours. Get them involved in that program. Incentivize them, if you receive a payment. Get everybody working and headed in the same direction. And I think it'll work out. I'm not just talking about this theoretically. Stacy and I, that's what we did for our careers. We were much younger, is that we built and owned and operated buildings. And once we developed an employee engagement and satisfaction program, and we're actively measuring it every month and incentivizing our administrators to hit certain levels on the scores and really focusing on areas where we weren't doing well, we completely turned our operation around, and it became fun to run our buildings. So I would just encourage people to really double down on employee engagement.
I think internal marketing is probably just as important as external marketing. Talking about the why, I think, at least in the culture here, we talk about the why quite often. Why do we do what we do? And I think that's very important in terms of every industry. Going into the deal-making area, based on my conversation with clients, people are still making deals, people are still buying. Steve, what have you seen in terms of deals? Are banks more apprehensive about financing? Tell us a little bit about it.
So it was interesting to see how everybody worked lock and step over here, where you had, when the pandemic started in April and May, there was pretty much a complete stop where everybody put most buyers just put everything on hold. Anybody that would talk to me about a deal, I was like, really? Are you really looking at something right now? Nobody had any idea what's happening. As the government stimulus started to take hold, and as we moved into, especially when we got the $5 billion specifically allocated to skilled nursing, at that point, it became clear that the federal government is going to support our industry. And I'd say across the board, the activity that happened at that point, that started at that point, in terms of people looking at deals. From an activity standpoint, pretty much matches what it was prior to COVID. Now the question will be, will they, over the next month or 2 or 3, getting to the finish line is slightly more difficult, slightly more challenging at this point, simply, till you get the right balance in terms of valuation. But clearly there's an interest. Clearly there's an interest in buying. There's equity. The equity partners are interested in coming in. The lending partners, the banks, frankly, I don't know if they have a better place to put their money at this point. I don't know that office buildings or retail or restaurants or hospitality are better at this point or more secure than healthcare. So the equity partners are very interested in getting in. The banking partners are there. They are closing deals. Maybe a little bit, maybe a little bit more diligence, a little bit more conservative in terms of, looking for some additional recourse, maybe slightly lower loan to value that they're willing to give. But overall, they are ready to engage. They're ready to close, and there are deals happening. I think a lot of the buyers the sellers that were on the brink, prior to COVID, see this as a tremendous opportunity to sell. They are, especially the mom and pop type operators, the nonprofits that, don't want to or don't have the strength or the stamina to go through this for another year. They're looking to get out. But I would say that the distressed purchases or the heavy discounts that people thought would be coming our way have not presented themselves at the time. There are slight adjustments in valuation, but overall there's interest in buying, and the valuations are not yet at a sharp discount.
In terms of Mark, in terms of HUD 232 loans, has there been any talks related to that? Any apprehension about those insured loans?
There has been. We're working on something that right now doesn't look like we're going to be able to get. I mean, we're still lobbying it, which is that we're trying to get included in the Stimulus 4.0 bill, a program that would defer people's payments for a year and then just allow them to refinance it as a second mortgage. It'd be a tremendous cash flow benefit for anybody that has an existing HUD loan. And we still have a shot at it. Unfortunately, it did not make the cut in McConnell's language, but we have a bunch of folks that are lobbying on it. And if we could get it, those of you that have HUD loans, understand how great it would be to not have payments for a year and then be able to turn that into whatever the amortization period is left on the life of your loan. So that's the only thing that's really in play right now on the Hill as it relates to HUD loans. We have been able to get HUD, and a lot of other people deserve credit for this other than myself and the AHCA. There's a HUD community of folks that have worked hard on these issues, so I don't want to take the credit away from them. But they've been able to work with HUD, and we've helped a little bit to get some improvements made around the edges of the program. But there's just so far that HUD can go before they need statutory authority to offer something as big as like a 1-year deferral on payments. But we're still working on that.
Steve, is there any key performance indicators that you think operators should be looking at differently compared to pre-COVID times?
Well, I think there's one key performance indicator which was the same as before, census. A couple of operators were heckling me on the way in over here and saying, so are you going to tell us how to fill our buildings or not? So, I kind of told them, hey, if you wait till the end, if you listen to the whole thing, then maybe you'll get the magic potion. But,
let's hear.
The reality is that none of us have the magic potion, and that's going to take time. But we've had a lot of conversations, and we've seen a lot of focus on burn rate. And in our environment, what the burn rate means, how many months do we have, how much cash and how many months of losses can we absorb before we fall apart, or we need additional stimulus funds from the federal government. So, we are looking, and in places that have been hard hit, it's a couple of months. Places that are had less of an impact, so they have a little bit more than a couple of months to survive, without the profitability. Cash cash on hand and current ratios. People are looking at, a lot of burn rate conversations. How long can we survive this?
So Steve, I'm curious on your thoughts. If you think about this next $5 billion that's coming, the way I described it, for the folks that aren't in the Northeast, that are kind of out there in the rest of the country, how far does that get them before they're in trouble again? How many months runway do they have?
The folks in the Northeast, again, the original funds got them a couple months, let's say 2-3 months. So this will probably give them another 2-3 months. If they're lucky enough to have been able to participate in PPP, they may have, some additional time. So I guess we're kind of looking at, with this money, hopefully most operators can get close to the end of the year. But at that point, we're really hoping for either a turnaround or an uptick in census, or at least people getting to their break-even point, and then and if not, having some additional funds coming our way.
We're running out of time here. There's a lot of questions that come through. If we don't get to them, or if we didn't talk about them, we'll try to follow up with an additional email or additional guidance on those. One thing I do want to mention is that on the accounting side of things, there's a lot of terms and conditions for all of these stimulus packages, PPP, the Provider Relief Fund. It's very important to read through those, or have somebody read through them, especially since they're updated on a continuous basis. A lot of this was obviously pushed out to get the funds out as fast as possible. And it's important to continuously look at the frequently asked questions and the terms and conditions to make sure that you're on top of that situation. In terms of the CARES Provider Relief Fund, right now it is considered a federal grant, and federal grants do require certain audit requirements. Please be aware of that. There's probably going to be additional guidance coming out in the next few months about that, but providers should be aware of that. At this time, Mark, if you want to close us out, anything you want to bring up that we haven't done so.
I was just looking at the chat to see if there's any other questions that I could answer, but if you do need any follow-up, feel free to contact me. I would just say what I know that all of you have heard, in the past, which is that this has been the roughest 5 months in the history of the sector. And I'm just really proud of you and the rest of the sector for not giving up. One of the things that's going to be really interesting is when a deep dive occurs on what's happened in the rest of the world. We've already done the research on that. And in the rest of the world, in many long-term care settings, the staff ran away from the buildings in fear of getting COVID themselves and left all of the residents to die. Here in this country, we did really just the opposite. You and our teams and your teams rushed towards the facilities and towards the residents. And we received a tremendous amount of negative publicity, but I really think that when the analysis is done, that our story is going to be better understood, and our story isn't over yet. There's still a really rough 5 to 7 months ahead of us, and Godspeed as you continue to work to save the lives of these folks, and we'll do everything we can to try to make it a little bit easier for you. But thanks for what you're doing.
Steve?
So just to echo, listen, we've lived through unprecedented times. The challenges are something that none of us expected, none of us have ever experienced. But one thing I would say to operators is that you're not alone. We see the same challenges across every operator, across every organization. And more so, I would say you're not alone, largely because of the advocacy of AHCA. The federal government is there. They've indicated that they're going to be there to help us. And, I think that we're not alone. And that gives me a lot of encouragement to know that we're going to be able to weather this, and we are going to come through on the other side stronger than before.
I agree. So I just want to thank you both. I think it was very insightful, and I think I hope our participants enjoyed and got something from it. Thank you very much for coming. We are going to release additional guidance as they come through, additional stimulus packages as they're released. We will be giving out additional webinars or email guidance about that, so please be on the lookout. Thank you very much for joining. Have a great day.